Good morning, everybody. This is Dr. Aaron Seaton again with the Chiropractic Place here in Redding, California. And today I wanted to kind of talk to you about three most common symptoms of low back pain that I see, the three different causes that I typically see in my office, just to help patients better understand kind of what we're looking at when somebody comes in with back pain and trying to better understand how we can help them. So first and foremost, the number one thing that I typically see in my office is somebody experiencing a sprain strain in their low back. A lot of the times they might be, have pain on their left side, be leaning to the right. They kind of come in like this. Usually those are an acute injury. They were lifting something. Perhaps they were doing gardening that weekend or helping a friend move. And then they just kind of go do something and then boom, this thing hits them. This is actually the most common thing that I see in my office as far as low back pain. So typically it's pain on either side of the pelvis. It could be the right side or the left side. Usually the patient is leaning away from the side of pain. We call that an antalgic lean, where they're pushing away from that side because of all the inflammation. They're taking pressure off of it. Usually sprain strains like that will resolve quickly. Using ice on that can be very helpful, especially if you have this brand new injury where you're 8, 9, 10 out of 10 type of pain. Using ice just to help mediate that pain can really help. Sometimes this pain wants to follow all the way up into your lower mid back, kind of into your lower ribs. That's really common with a sprain strain in your low back. And sometimes you can get radiating pain down in kind of the back of the leg that usually doesn't cross the knee, but that's most common with a sprain strain in the low back, or what we call the sacroiliac joint here. That can create a lot of pain, a lot of discomfort, and people can get really nervous when they have these because the pain is very intense. But what I always tell my patients, if this is what I suspect, these are typically 10 to 14 days. The first 3 to 5 days is usually the most intense, and then we start to see, this gradual improvement start to take place over time. So that is definitely the first thing I see. Second thing that I see in my office is common is a disc problem. And a lot of people, when they first start having low back pain, they want to know what's causing it. So with discs, typically these are usually what we call micro traumas over time. There's usually not a major event that sets one of these off. Usually the disc is having some wear and tear over time. A lot of times people just wake up in the morning and they have this pain in their back that's shooting down their leg. In a lot of cases with discs, it'll come all the way down the side of the leg into the foot. The pain is usually worse in the morning. That pain may start to get a little better over the course of the day, because what happens is when we're sleeping, a disc will rehydrate at night. Most people don't know this, but you're actually anywhere from 1/4 inch to 1/2 inch taller in the morning because your discs start to rehydrate at night. So if you're 5'7" like me, you want to take your height measurement in the morning, get that extra 1/4 to 1/2 inch. So with discs, they're worse in the morning because they swell up at night, and then as you get up and move around and walk around, it tends to alleviate the symptoms somewhat depending on the level of disc involvement. Sometimes with discs, it can be 10 out of 10 nerve pain all day long. A lot of the times people will report, "Doc, I take ibuprofen, I'm taking Advil, nothing's touching it, this nerve pain won't stop." That's usually an indication that there's some pressure on that nerve, and usually the anti-inflammatories don't really take the edge off of that shooting pain down the leg. This can also be helped with chiropractic care. It's very important for discs to move in order for them to heal. Discs do not have a very good blood supply, so they actually get nutrition pumped in from the bones above and below. So if that joint is stuck and not moving, it's going to make it very hard for that disc to heal, and some chiropractic care can get that unlocked and get that disc moving and pumping so it has a chance to heal. And these typically heal slowly. The course of, some of them can be 6+ months for these to improve. So this is another thing that we see. Another thing that I do see in the office is patients with low back pain with kind of that chronic arthritis, where it just kind of aches a lot. They report that with exercise and movement, they tend to feel better. If they sit for too long a period of time or sit on hard surfaces, it can really start to agitate this. So these patients also respond very well to chiropractic care because arthritis is a joint that has wear and tear. The cartilage is wearing out and we're getting bone moving into that joint space. That's what arthritis does. And so the more movement we keep in there, the healthier we can keep that cartilage and hopefully slow that process down and give that patient a much better quality of life. So hopefully that explains just a little bit of the differences. By no means should this video be used to diagnose what's going on with you, but hopefully it gives you kind of an idea of what a chiropractor is looking at when you first come in. And this is why we do a thorough examination on our patients. We take digital x-rays right here in the office on that first appointment to help better understand what's going on with our patient so we can explain to them what the care plan is, what we think is going on, and hopefully see some results for those patients over time. So hopefully that helps you understand a little bit more about low back pain and what we can do to help. If you have any questions, please give us a call here at the office. I'm Dr. Aaron Seaton with the Chiropractic Place.